Thanks for joining us. Now, it was a choice between his future dream of becoming a doctor or just to stay at home and receive proper medication to save his life. Though tough, a parent of a 12-year-old diabetic boy, Abubakar Mokhtari, chose saving his life over keeping him and 3 of his siblings in class. The choice was to enable the Mokhtari siblings to receive regular supply of insulin from the Diabetes Association following the agreement between the National Diabetes Association of Ghana and International Diabetes Federation to provide children with free insulin. The drug is too expensive to acquire from pharmacy shelves outside the hospital. Joy News' Kweti Nate has more.
If there is anyone feeling the pinch of the lack of support from organizations such as the National Diabetes Association of Ghana, then it's 12-year-old Abubakar Mokhtari. Abubakar was diagnosed with type 1 diabetes when he was 7 years old. Type 1 diabetes is a lifelong medical condition and is the leading cause of diabetes in children of all ages. It is an autoimmune disease in which the immune system destroys the insulin-producing beta cells of the pancreas that help regulate blood glucose levels. Abubakar is 12 now, but looks malnourished compared to many children of his age.
My name is Abubakar Mukhtar, and my mom is this.
Abubakar accesses health care at the Kolebu Teaching Hospital, the very facility Ms. Denyo of the Diabetes Association claims to be supplying with vials of insulin. But Abubakar has never received the free insulin. Even more worryingly is the fact that Abubakar and his 3 siblings have dropped out of school because of his condition. His father had to make a choice between spending the family's meager income on his treatment and paying their school fees while they watch him die slowly.
The diabetes started. I'm feeling lazy, but so I'm suffering because my father don't have to look at everything they say he should buy. My father cannot buy, we say we buy, but he doesn't have money to buy it, so that worries us.
One of the health targets under the Sustainable Development Goals is to achieve universal coverage by ensuring financial risk protection and access to quality essential health care services. Abubakar, looking all pale in his yellow jersey, is one of the children who have subscribed to the National Health Insurance Scheme. But he does not get his full dose of insulin under the skin. A nightmare his parents have to contend with.
My mother doesn't have any work to do. So if I sick, if they are bailing us, he doesn't have money to pay. And my father too is a driver, but now he doesn't have a car. So that worries us. So now I'm not going to school too.
So now you're not going to school?
Yes.
Why did you stop schooling?
I stopped school at 2 years now because of the money. My father don't have to pay our school fees and giving us to go to school. So and I have 3 junior brothers too at home. Them too, they are not going to school because of the money.
Meanwhile, fresh revelations gathered by Joy News reveal how sponsored insulin meant for free distribution to children like Abubakar, as you saw, is diverted to adults. It follows earlier reports by investigative journalist Kweti Nate how officials selected by the Diabetes Association to distribute free insulin and glucometers sold it to poor patients. A diabetologist at Kofoanoche Teaching Hospital, Dr. Safo Kantanka, says the president of the Diabetes Association, Elizabeth Denyo, sent his unit 600 vials of insulin meant for children to be given to adults 2 years ago.
In terms of number of vials, we received 600. They were in 3 boxes, but it was 600. So it came and in the clinic folders and in the clinic record, it's well stated in the number of vials and the number of boxes that we received. So, in fact, as a matter of fact, I cannot check from her side, but I'm telling you for a fact that the number of insulin and the particular brand, it was only one brand, Mixtard, that we received in 3 boxes.
Who were the beneficiaries of these insulin?
The beneficiaries of the insulin are people with diabetes that we take care of. That is adult. That's patients who are above 25 years. Like, that's how we classify. Who are on insulin, you understand? That means they will require insulin to control their blood glucose as against drugs like Danel or gliclazide or any other drug like that you take orally. There are some patients like that who are on only insulin that will be able to help them survive. So they are that category. And unfortunately for us, some of those patients are on high doses of insulin so that the National Health Insurance is not able to provide the amount they need probably for a month or so. So they will then to go and buy. Some of them, they don't have funds. So then they give us that information and we prescribe for them and we alert the nurses that this and that patient will require insulin. And then they go and get it free of charge. So in fact, if anybody says that those insulins are given to adults, then it's the truth.
But are you aware that this insulin is meant for only children? Was that indication made to you?
The indication, I know that there's a particular program under the International Diabetes Federation which supplies insulins to deprived countries like ours for adolescents and children. Yes, so I know. But in the same way, if we are getting donations from the Ghana Diabetes Association for our patients who are indeed lacking, we cannot say no. We cannot reject it.
Expect the full version of Diabetic Diversions on the Joy News channel shortly.